Hi, my name's Kalie Day, and I'm in the FSCJ nursing program. Today I'm going to be showing you how to administer IV medication through a piggyback. So the first thing you want to do before you draw anything up, you want to check your physician's orders, your MAR, and go through the 5 rights of medication, which is the right dose, right medication, the client's name, the time, and the route. So once you've done that, you can go ahead and draw up your medication.
This one's mine, but I'm just going to use yours one more time since I can't clear it.
So you clean this off. And then today we're going to be inserting 3 milliliters of flagyl. So you inject 3 milliliters of air, and then you can go ahead and draw out your 3 milliliters of medication.
I think that's why your flash mic was stopping.
Yeah, because I don't think I have to go ahead.
Alrighty, and now that we have our medication drawn up, you go ahead and dilute it in the bag. Okay, then you deposit this in the needle box. Now you slightly agitate your medication, and then once it's mixed, you put on your medication label. And on the medication label, you have the client's name, the drug, the dose, the time, the frequency of the drug, and your initials. You also want to calculate the drop rate and the flow rate. So once you have your drugs all calculated, you then can go ahead and prime your tubing. You take off this cap and spike the bag.
Well, in the beginning I did. I was just trying to think
You prime your drip chamber. You want it to be about halfway full. Then you slowly release the clamp and allow the air bubbles to go out. So now that you've done this, you can go in your client's room. Hi, Mr. Johnson. My name's Kalie. I'm going to be your nurse today. The doctor has ordered some more medication for you to go through your IV. Okay. So at this point, you go through your standard precautions. You wash your hands. You'd apply your gloves. You'd ask the patient for 3 identifiers: his name, his date of birth, and where he is. So once you got that done, you also would ask his allergies.
I've already drawn up my 3 milliliters.
So before you do this, you want your primary bag to be lower than your piggy bag.
I have primed the tube and clamped it back off. I'm going to set it here while I wait for the rest, and then I am going to select my vein.
Here.
Find a bouncy, resilient vein that is not on the dominant side, not on the side
you have your tube up, you take a piece of tape,
or shunt for renal dialysis.
Label your tubing, and on your tubing you label the date, the time, and your initials.
I'm going to go right here.
Okay, and since this IV is already painted with the primary line, you can just...
But first I'm going to apply the tourniquet.
Clean the port. Apply your alligator clamp. Clean the port. And attach this. And you want to clamp your primary line.
I am going to sterilize the site
release
with my
the clamp on your piggyback so that it starts moving forward. Okay. So then you're establishing the new flow rate. You're watching the drops. You're making sure it's going through at the right time. Okay, so once you've got all your medication drained where it needs to be, you clamp this off again.
It's going to be at 15 degrees angle, double up.
Undo this, and you take off the old alligator clamp, and then you apply a new one. You hang it up here, and then you would turn back on your primary medication line so that it can run. Okay. And then at the end, I would take off my gloves, wash my hands, and I would document on the MAR the drug, the dose, the time I started it, the route of the drug, how the IV and the site was looking, and the volume I delivered on the intake and output. That's it.